In rural and indigenous areas of Latin America, such as Chiapas, Mexico, there is a persistent state of emergency in the area of women's health and obstetrics. In remote, impoverished, and politically marginalized areas, there is a high infant mother mortality because the healthcare system does not extend well into these areas. Births are attended by local midwives who rely on traditional knowledge and personal experience. Some government health authorities disapprove, but the reality is that these traditional birth attendants are the ones delivering babies and keeping the mothers alive. They are the only hands available. The PACE Certified Obstetrical First Responder Program is a way to reduce infant mother mortality by training traditional midwives with the latest medical techniques and creating a link of communication and respect with the medical authorities so that midwives can transfer emergency cases to higher levels of care with enough time to save lives. PACE is a dynamic organization dedicated to improving medical care in emergencies in Mexico and Latin America. PACE has trained 10,000 doctors and nurses in ALSO, Advanced Life Support for Obstetrics. They're the only provider of this gold standard course in Mexico. Not only does PACE offer training in cutting-edge life-saving techniques, but they are constantly innovating methods of adult education using hands-on simulation to overcome linguistic and cultural barriers. PACE turns experimental learning techniques into proven training programs. The PACE Obstetrical First Responder Program is a new concept focusing on the last kilometer of care. In inaccessible rural areas, women with postnatal hemorrhaging may travel for hours to receive adequate emergency medical care. Far too often, they die before reaching a hospital. If they do make it to an emergency room, precious time is lost as doctors must reevaluate and diagnose the problem. PACE's solution covers 3 areas. Training for traditional birth attendants, midwives, with scientifically sound practices and clinical methods, giving them options they do not already have, such as simple pharmaceuticals, early diagnosis of emergencies, and how to communicate with the rest of the healthcare system. Testing and certification of certified obstetrical first responders so that doctors and medical authorities will better integrate with the traditional birth attendants and community health workers so that they can work as a team to save lives. Create an mHealth emergency obstetric communication system so that obstetrical first responders can report an emergency using basic SMS. Hospitals will be informed of incoming patients, and a record will be created of the emergency and treatment that is continuous throughout the different levels of medical care. PACE will set up a pilot program in Chiapas, Mexico, where we are already established as leaders in community health and relied on by government healthcare providers for high-level training. Progress will be documented and monitored by an mHealth dashboard with measurable indicators: number of deaths, number of emergencies and near misses, number and type of medical interventions. This information can be used to fine-tune and improve the system. By seeing better coordination along the chain of survival, the number of deaths and complications will go down and successful interventions will go up. This will provide concrete proof that the program is working and ready to be implemented in other regions. With our innovative certification system, the best technology and instructors, and our philosophy of community-based training, we will bring the most advanced techniques to the most isolated healthcare providers. PACE, training for medical emergencies without boundaries.